we don't have a federal law for workplace violence prevention, but we do have the OSHA General Duty Standard or General Duty Clause, and that's been around since the 1970s. And what that says is that employers have the duty to, create a workplace that's free from recognized hazards that are likely to cause death or serious physical harm to their employees. Likewise, employees are responsible to follow the safety rules and regulations, and I'm going to add responsible to report safety hazards, otherwise we can't prevent them. Now, about 2 years ago, as Ruth alluded to, there have been efforts to pass a federal law for violence prevention for all healthcare in the US. Currently, that law passed the House, is in a committee in the Senate, and we don't know where that's going to go. But I did hear recently that federal OSHA are still moving forward with their own standard for violence prevention. So they're focused on violence prevention and infectious disease prevention right now. So we still may get a standard even if we don't have a law that goes through Congress. So we'll kind of have to watch this space about that. Now, there are many state laws that require you to implement workplace violence prevention programs. There are also 40 states with assault protection laws. So it's a felony to assault a healthcare worker, but I can tell you all of these laws vary. In the case of felony laws, for example, in Oregon, they don't protect nurses. In Washington, they protect nurses, doctors, but not CNAs. So that's just an example of how varied they are. So you need to know the laws in your own state to know how you're protected. Accreditation entities such as the DNV or CARF if you're in long-term care, and of course the Joint Commission. DNV and CARF do not have specific violence prevention laws, but they will look at the violence prevention program when they are assessing your facility and going through that accreditation process and inspection. So they will ask to look at worker safety programs and what you're doing to prevent hazards to workers as well as patients. And then you need to be aware that security laws vary from state to state. So if you have security personnel in your facility, in some states there's very comprehensive training for them that is customized for the healthcare environment. In other states there is no training, and you might just get training in order to carry a firearm, but it is hugely variable, and you have to be aware of those when you're developing a program. As Ruth mentioned, the Joint Commission promulgated a standard for violence prevention. I was part of their technical advisory group to help develop the standard. It was effective January 1 this year, and it's very broad. It's programmatic. It doesn't conflict with any of the state standards that are out there. And it really looks at identifying the risks for violence, addressing them, investigating them, implementing a violence prevention education and training program. And there's elements that are defined for that. And then you have to have a designated individual and a multidisciplinary team that's going to run this violence prevention program, and then develop all the policies and procedures, encourage reporting by staff, and then support staff who report or are exposed to workplace violence incidents. So what can you do related to standards? So here's just some tips for you and some resources. I'm going to put both of these up together. You can call federal OSHA if you think there's a serious safety issue or health issue in your work environment. There's a way to file a complaint with OSHA. And in 22 states, you have state plans. So you need to find out if you're a state where you have a state-run OSHA. And within those state plans, most of them have an enforcement arm and consultation, and they do not talk. So you can call consultation and have them help you with your workplace violence prevention program. Maybe they can help the committee develop the plan. Maybe they can do an assessment for you, provide resources. So again, find out what's going on in your state. You can also call their enforcement branch if you want to file a complaint for a safety or health hazard. If you do file a complaint, you're protected under federal law. This has been around for many years. It's the OSHA whistleblower protection. There's information that you can find at this link. And then, as I said earlier, know your felony laws and reporting rights in your state. And then lastly, know if you have a workers' compensation ombudsman in your state. There are several of them around, and I found them very useful. If you have a workers' compensation claim, you've been injured on the job, and maybe it's being denied, or you're not clear about your rights, whatever it is, there's confidential help. So find out if you have an ombudsman you can contact.